still a lot of people in line for the food, so they're on their way in. Oh, yeah, no. Takes everybody a few minutes.
Hello. Good afternoon and good morning to our colleagues in Jonesboro. Thank you so much for coming to our last Global Health Grand Rounds. We have had two very good sessions, and this one is no different. Today's topic is Global Health Challenges, Women's Health. And today we are really, truly honored and blessed to have Dr. Isha Mehta. She is the Chief Gynecology Division at Elmhurst Hospital. And she's also Assistant Professor at Icahn School of Medicine and a co-founder of A Stitch in Time. And she's going to be talking to us about different aspects of global health, regarding women's health, and of course, a little bit about A Stitch in Time. Let's welcome her with a round of applause.
Thank you everyone for coming today. Thank you, Linian, for that kind introduction. I'm OBGYN by profession, and women's health is at my heart, and I'm so glad to share my passion with all of you in the audience. So goal of my presentation today is to just go over some basic statistics in women's health. And then I'm going to go over a few topics that are related to women's health. What are the top 10 issues in women's health? Then hopefully I'll go over by different age groups in the lifespan of the women. What are the issues in the life of a woman, starting from a child to adolescent, reproductive age group, and older age group. And hopefully then try and focus more on how we can address these issues at individual level, at the level of the medical student, at the level of the resident, at the level of an institution, and at a wider scope as a global citizen, what we can do individually to improve women's health. So just to start my conversation, being born as a man or a woman, that's where you start the impact of health. Your gender is different, your biological, you have difference. So it's very important that the way you are born, man or a woman, that impacts your life health right away. And women all over the world, they are discriminated socio-economically, and gender equality is least for the women all over the world. So my goal today is for you to focus beyond women's health and to go over in other details that we have to talk about. So just to go over some basic statistics, we all know this, 289,000 women have died during pregnancy and childbirth. That means one life is lost every 2 minutes. And a talk by Graca Machel, she talks about we know what we have to do to save the lives of the women and girls everywhere. Needless death of a woman, newborn and child must stop. We must do more and we must do better because every action and every life counts. 225 million women, they have unmet need for contraception. I'm part of the project that is initiated by New York City. It's called QUINCA. It's a contraceptive access for the women. So every woman that walks into your hospital, if she wants a contraception, she goes home with a contraception. All over the world, 225 million women has no access to contraception. And talking about Melinda Gates, what she said, if women can plan their families, they are more likely to space their pregnancies. If they space their pregnancies, they are more likely to have healthy babies. If the babies are healthy, they are more likely to flourish as a children. So we, as a women's healthcare provider, it is our job to offer contraception to women. 52% of the maternal deaths happen in the pregnancy or soon after the childbirth. And they are all because of the preventable causes: hemorrhage, sepsis, hypertensive disorder. 28% of the maternal mortality happens because of the non-OB related causes: malaria, HIV, diabetes, cardiovascular disease, and obesity. And 8% of the death is due to unsafe abortion. So that is our major goal, is to provide contraception. Switching the gears from maternal mortality, let's look at this: 270,000 women die of cervical cancer. Do you know what is the death rate in the United States because of cervical cancer? Anybody in the audience? 4,000 only. So you can see the impact of cervical cancer screening that we had in the United States that reduced the death of cervical cancer versus all over the world. It is still #1 killer. And anybody know what is the #2 cancer in women? Breast cancer. Still the same issue all over the world. We are in much better position in US than in other part of the world. And the major impact is 1 in 3 women between ages 15 to 49 have physical and sexual violence, either inside or outside this home. All this data makes you feel so sad that, what can you do as an individual? How can we make an impact on the lives of these women where we are? Talking about child health challenges, 5.9 million children under 5 has died because of the preventable disease. That means one child every 11 minutes. We have to do something about it. And you can see that 60 to 80% of the premature or small for gestational age are there. I have to share a story that I went to Ethiopia with AIHA for my mission. And I was assigned to labor and delivery ward. And, there were a lot of deliveries happening. And there was one baby laying in the corner. So I just walked to the labor floor, end of the labor floor, and I said, what's going on? Oh, this is a preemie baby. So I said, so? Yeah, we don't do anything for those babies. They just stay in one corner and then they die. So, since I saw that happening real time in front of my eyes, we initiated a program in Ethiopia about saving a premature baby. We had a team of doctors from Ethiopia traveling to my hospital, going to the NICU, how to resuscitate the babies, what are the things that they need to have in their infrastructure, how they can save these preemie lives. So, when you see all these things, that's when you realize that, yes, we are here in US, very privileged. We have no idea what is going all over the world and what we can do as an individual to change the life of that one person, one woman, one child. More statistics. All of these infectious diseases, 43%, are all preventable. And 2.6 million babies are stillbirth. That means women had no idea the baby was dead. So all these statistics are very alarming, very alarming. And you just feel like that, help is needed. Going into adolescent health. Anybody ever thought about this? 1.3 million adolescents died in 2012 because of the preventable causes. And this is the place this is Ethiopia where I work in Debre Birhan. There was a place called Fistula Town. I said, okay, what is this Fistula Town in the middle of the town? I said, these were the place for all adolescent girls who developed fistula during their childbirth. They were thrown out of their houses, and they were staying in this Fistula Town. So this is the impact of that childbirth that happens unattended. There is no health, there is no delivery provider there. And these girls will develop fistula, and then for the rest of their life, they're social outcasts till a doctor will go there and repair that fistula. So looking about these numbers, 15 million adolescent girls are married under age of 18 all over the world. 2.5 million, they gave birth when they were under 16. And that is a major impact all over. One of the conferences that I attended, International OBGYN Society's meeting, that was the main goal for all these countries, how they can avoid that marriage of that girl who is very young. And if she gets married, how could I give her contraception so she does not get pregnant till she's mature mentally and physically? So it is our job as a healthcare provider that how can we go out there and impact the lives of all these young girls. And there's a new problem arising in adolescents. And I laugh at this, that 80% of the adolescents, they are insufficiently physically active. So, looking at all of this, moving on, 70% of this preventable death in adult age is related to what we do as a teenager. And 30 million women, adolescent girls, are at risk of genital mutilation. And one of my friends works with this mission who is trying to help girls who are mutilated. They bring them over to United States, they do their surgeries, and they make them emotionally and physically feel better. So this problem is out there. It is our job to see how we can help them. So to summarize, what are the top 10 main issues in women's health? We all know that cancer, cervical cancer, breast cancer, reproductive health, that is access to contraception, prevention of STIs, maternal health, preventing the death that happens during the childbirth, HIV, STIs, violence against the women, mental health, non-communicable diseases, and then being too young and getting old. So one of my other places, this is where we go as a NGO called Stitch in Time. We work in this floating hospital that right there in that ship, that is a floating hospital that goes in a deeper part of the river, Brahmaputra. That's where there are small islands formed because of the flooding. And these women, they have no access to health care at all. So we as a doctor, we go into those ships and we do the surgeries for these women. But you can see these women lining out there who has a problem, and they have a problem of prolapse. Why do women develop a prolapse? They are married very early in their life. They have multiple children. They are hard laborers. So by their 30s and 40s, these women have their uterus coming out. And these women, then they are thrown away by their family, by their husbands. because they are of no use to them. So these women are in the streets. So when we go as an NGO, we try and take care of these women on this floating hospital once a year, and that gives you more satisfaction. At the same time, we teach their daughters that how can you avoid this problem happening to them. So it feels very satisfying when you go out there and take care of these women who has problems with that. So going through women's lifespan, the cause of death or morbidity is same when you are young, between infancy to childhood. A lot of young girls and boys, they die of the same reasons: prematurity, birth asphyxia, and infections. And some infectious diseases like pneumonia and then malnutrition. Moving on to adolescent, what are the top problems in adolescent life of a woman? Mental health and injuries, HIV, adolescent pregnancy, substance abuse, and nutrition. And then moving on to reproductive age group. What are the main issues that women face all over the world? HIV, AIDS, maternal health, tuberculosis, and injury. And then big one is the cervical cancer, violence, depression, suicide, and then disabilities. And even worse, when we are getting older, we have more problems. Okay, so women, everybody knows that women live longer than men. So the longer they live, there are more problems. World overall, more incidence of non-communicable diseases and cancers and chronic conditions. But this disability, women have no access to healthcare at all. And that's why they never receive any care the way the men receive in those worlds. Hearing loss, poor vision, arthritis, depression, dementia. I know this is all making you all very sad, I'm sure. But I think we have to do something about it as a woman's healthcare provider. So, when I was researching about this global health lecture, I only do part of the work, but I just felt that as we earn more money, the problems are different. So the top 10 causes of death in the women overall are like this. But if you look at this, comparing the curves from low income to higher income, lower respiratory infection, HIV, AIDS, and diarrhea are the top 3 causes. As the income goes up, your heart disease and stroke are getting worse. And same problems when in our culture. So all this data is really depressing. It's really depressing from the women's health perspective. But WHO, and there are lots and lots of people out there who are really passionate about what they do. And this is WHO's directive, every woman and every child. And they have strategies, how to survive, how to thrive, and how to transform. So it's not that nothing is done. All these data are still there, but they are much better than what they have been before. A lot of things are achieved. Lots and lots of lives of women were saved during the childbirth. There is improved access to contraception. There is decrease in the maternal and child mortality. All the incidences of malnutrition, malaria, and TB is all going down. But there's still more to do. There's still more to do for all of us out there. Along with the health care, there is need of improved education, clean air, water, sanitation, nutrition. So, being a doctor is not enough. We need to build a society together to have an infrastructure that helps you build to that level. And it is a woman's role that is very important, that if a child is educated, she's going to carry all that with her and then pass it on to her kids, her family, and to the next generation. So education, in my mind, is very important, along with basic necessity. If you have a clean air and water, you're going to reduce the number of diseases that we are going to get. It's just the common sense. And then my role comes in. My role is all the way at the end. All these other things needs to be done at the beginning. So this is WHO's motto. I mean, all this, data is coming from WHO's website. So the global strategies survive. Just the basic instinct. You want to end the preventable death. And then you want to thrive after that. And then ultimate goal is to transform what we have right now. This goal is very ambitious, very ambitious. And, it not only recognizes healthcare, but there are other aspects that needs to be improved also for us to do a better job. So, I was telling my daughter, she's an environmental engineer, I said, I'm preparing this presentation. I said, but the world still needs you. I said, I cannot do a good job if there is no clean air and clean water. So every person, no matter what you are, who you are, there is a role for each and every one of us in making an impact in the life of the society and the woman's life, and then moving on for the next generation. So the survive, what does it do? We want to reduce the maternal mortality to 70. Anybody has any idea what is the current maternal mortality in US? How about US? Any guesses? We know that we are the only developed country that has the highest mortality among all developed countries. So all other developed countries, their mortality is going down and ours is going up. And American College of OBGYN has an initiative how to avoid or prevent maternal death. So overall, globally, the death rate is more than 400. They want to go down to 70. US is 25, right? 25. But overall, other developed country is 6. Okay, so 6 per 100,000. Let me go back a bit. I guess it's okay. And then once you have, you have taken precautions, you have done the prevention, you have this goal set up, then you want to sustain that goal. You cannot just, okay, I went there, I did one surgery, I took care of one woman, but that is not enough. We need to go above and beyond what we are doing. So the goal is for us to go out there and teach the mid-level provider, midwives, medical students, or whoever is out there in the field, to teach them with the basics, that how you save a life. Once you save a life, you pass on your knowledge to the next person, so that person can then save the life of other people. In Ethiopia, when I was there, I was told to teach high school students. I was working with a nurse who was trained to do a C-section to save a life of a woman who walks in, God knows how many miles from her village to the hospital. She would walk in. I was telling Lillian my story. There was one day I was really bored and there was nothing going on for me. Living room was open and I was just sitting near the front door. And the bus came in. 3 people came out of this bus. 2 men and 1 woman. Woman could not walk. Her legs were being held by these 2 men. You look at her belly and you know she has a ruptured uterus. The way she walked, she could not even put the foot down. And that's when, we all see that there's something going on. OR was opened up and her life was saved, but her baby had died already. So, it is very important to sustain what is being done. Like I said, one life. But if I don't teach that skill of that other doctor who is going to stay back there, she was going to die on her way here to the hospital. So that is ultimate goal for all of us as a healthcare profession in global health and women's health, is to continue teaching and training the next generation and transform. All this health focus and all these things cannot be achieved if we don't have a grassroots improvement. So, we have to improve poverty. There has to be good education. There has to be access to water that is drinkable. All of these basics that we all thought and we took it for granted. I tell my daughter every day that you have to be thankful for what you have. In the OR where I scrub with my residents, they wear sutures. It's so important that we don't realize that how privileged we all are. When you work in these hospitals that I have worked, the doctor will not let me tie the knots because I was wasting suture. He said, Isha, you can do anything you want, but I'm not going to let you tie because you American doctors, you waste your resources. So that one C-section was done with the 2 chromic catgut. Only 2 chromic catgut, skin to skin. And they were one of the fastest surgeons. Being said that, I'm just teaching my residents and my students that, you have to appreciate what you have because you have no idea what the women and children are facing outside of U.S. So I have privilege of working at all three places back in, a lot of places. In India I worked in Bangladesh, I worked in a floating hospital, but there is no blood bank, there is no doctor nearby for God knows 100 miles, and I had to take a small boat to go to the land and then bus. Woman would die in the meantime. Same thing in Ethiopia. Even though we did a lot of major surgeries in Ethiopia for ruptured uterus, there is no blood bank. There is no blood bank. So that makes you really, value your education and what you have learned for all these years, how you can make a use of it in a way that you can impact on somebody's life. I hope that my daughter will continue my dream, but, she said, Mom, I cannot come with you all the time. So I said, it's okay, you don't have to come with me, you're not ready yet. But she has saved every single dollar that she has received in her birthday gift that goes to my NGO. So you can always help in different ways. All these things that everybody does, I am a doctor, I can do it, but not everybody can do that. So money is always needed. So I want all of you to know that don't ever feel, I can't do anything. There's always, you can do something anytime, wherever you are, no matter what your profession is, you can do something to make an impact. So, being an OBGYN, this is my heart and my soul, hemorrhage, infection, unsafe abortion, and eclampsia. I have seen women dying in front of my eyes with this problem. So I ask my medical students one question. Do you all know how much blood is flowing into the term uterus? Anybody knows how much blood goes into the uterus at 9 months of the pregnancy? Anybody in the audience? How much blood goes to the uterus? What is the circulation of the blood every minute that goes to the uterus? 500 cc's of blood goes every minute into that uterus. If that woman delivers a baby, her uterus is not well contracted, you can calculate how many minutes it's going to take for that woman to die in front of you. So, as an OBGYN, when I go out there, we teach mid-level providers, midwives, how to first prevent postpartum hemorrhage, establish proper prenatal care, look out for the problems in the prenatal care that she's at high risk for hemorrhage. We all know as an OBGYN, I don't know any OBGYNs in the audience, we all know that it is totally unpredictable what's going to happen to you. Patient can just walk in and she can hemorrhage on you. So first goal is prevention, but you teach people that, but it's not enough. You need to be able to treat that patient. So those are important things that I teach those mid-level providers, midwives, who will then go out in the village to practice and then treat. And that's when the role of that nurse who was trained to do a C-section came about in a lot of African countries, that how can they save a life now? They have tried everything in their power, but they cannot let this woman die. So the C-sections were taught to save a life, or hysterectomy was taught to them. And I was kind of scared in the beginning when I was told that this person is rotating with me to be trained to do emergency surgeries. C-section was one of them, appendectomy was one of them, ectopic pregnancy was one of them, and gallbladder was one of them. And then cataract was different things. So, all these surgeries are taught to a person who has no background. To do a surgery is an art, but it's just a practice. If you keep on doing it again and again and again, you're going to get it. You don't have to know basics, okay? You have to know something, but you need to just know the basic principles, and you can do the surgery and save somebody's life. And, unsafe abortion. Growing up in India, I know that abortions were illegal, and so many girls died because of unsafe abortion. And I still remember I was local hospitals, the night CMO, and the girl comes in coma. I was brand new, CMO, just came out of the medical school and residency, and I said, okay, that's it, I'm doing it. And this girl comes in unconscious, and there were like 50 people around her. And I was so intimidated by this group of people, I didn't know what to do. And then I said, can everybody step out? I need to find out what's going on. She was hemorrhaging. She had very high fever. And then later on I found out that she went to some local doctor who gave her something, and she was miscarrying, and she just lost too much blood. And, ultimately she died because of sepsis. Those are the times that you really feel that, you hate your job, but at the same time, you can make an impact. And that, since then, it became my mission that how could I go out and talk to these young women in the school. Even I do it here too. We are a strong advocate in adolescent contraception in my institution, post-abortion contraception. We try and do everything in our power to avoid having those complications of unsafe abortion. Eclampsia, eclampsia, I have seen it so many times. We are very easy here. You know it all. We are on top. We have policies in place. We know what we're doing. But when you're out in the field, there is nothing there. The woman is seizing on you. And, I think all of these deaths are preventable. Proper training is needed. And, it's not their fault why women die, because healthcare is not available to most of them. It's not accessible. They have to walk. They are unaffordable. A lot of places, it's a fee for service. If you don't have money, you are not getting serviced. You're going to be sitting out there because you have no money. So, a lot of things are going on, and I think it's about time that, Lillian and I, we share this passion in women's health. Yes, there is, a lot of sad stories out there, but at the same time, there's so much more we can do as an individual, as a group. And there are a lot of big political organizations. They are backing up women's health, and they are making women's health their own priority. Bill and Melinda Gates Foundation, they are big in, this maternal health. They are also big in education too. So they are doing everything in their power to make a grassroots changes and then moving on and coming up to healthcare. I'm part of, Rotary International. Rotary International also shared the same, goal that WHO has. Melinda Gates Foundation has, and they have the same goal. And this is a very important saying that, by Amina Muhammad. You can all go through it, but, it is very important that, as a young, aspiring doctors in the field, there is so much out there that we need to do. And I really hope that, few people from here would definitely take global health and women's health as their primary focus and go out there and make a difference in the life of a woman. Because if you change the life of a woman, you will change the life of the whole family and the next generations to come. So it is in our hand to make a difference in the society. So, individually, I know what I can do, but I cannot do everything alone. We do have to work with a lot of people around here. And you also need finance too, because all these things without money, my NGO runs with my own money, and I know how hard it is. The surgery that I do for prolapse takes 3 to 4 hours, and it does $200 per surgery in Bangladesh, versus the same surgery I do here, 5,000 or more. We do hysterectomy with bilateral sacrocolpopexy. We do sacrospinous fixation, all of those, and AP repair, TVT, everything is done in the same package. Total vaginal reconstruction takes 3 to 4 hours, $200 in Bangladesh, $500 in Guatemala that we offer these surgeries, $5,000 to $6,000 here. Right? So everything is possible. You do need money. It's needed. And, we had a fundraiser yesterday for our NGO, and just have to say that without money, you can't do much. Yes, you can spend your own money, but at some point, you're going to stop doing what you're doing because you don't have enough money to continue. So you do need your well-wishers. And I guess this is my NGO, Stitching Time. And this many people will be waiting for us when we go there. We go to Dhaka, and from Dhaka we take a seaplane. The seaplane will directly land us in one of the rivers. And this is the view from our seaplane, how people are waiting. And then hopefully we'll start seeing the patients and start doing the surgery. and we have done quite a bit of surgeries over time, and it really, I work very hard there than where I work at Elmhurst. I have to tell you the truth. I start my day at 6 in the morning. I do not stop working till 1 a.m. And we have two GYN and 2 Urogyn's in our team. And it's like a full-time work, and we just don't stop. We do everything on our own. I do my own assisting, I do my own cleaning. I have learned so many things while I have been to all these places. In this floating hospital, that ship that you saw, I went to my central supply department, sterile. I learned how to sterilize my instruments. I want to make sure I have the same standards. I learned that stick that comes out, the color has to be green. That means it's good sterility indicator. I learned all of these things, and we took the same principles. Antibiotic prophylaxis, we want to prevent sepsis. We try and provide the same quality of care for the women that we do here. We try and provide the same standard, because we all know that all these other countries, they have antibiotic resistance problem. That is #1 global problem, antibiotic resistance. And I know my sister practicing in India, she has a cocktail for antibiotics. It took me forever to convince her that it is okay not to give more antibiotics. So that is our goal, to educate the local doctors that yes, 1 dose is enough for you, but then, so a lot of responsibility comes in when you try and go and do global health. And this is what I was talking to you about. Rotary International, that I'm part of, shares the same mission as WHO and Bill and Melinda Gates Foundation. So I'm going to share this video with all of you. I really thought, and it was very inspiring video. And when we talk about global health, women's health, this is one video that we have to watch. And there are more videos, how a person can change, what takes for us to change the habit and all that. So let's just go with this one. Maybe then we can stop my...
Visualization is right at the heart of my own work too. I teach global health. And I know having the data is not enough. I have to show it in ways people both enjoy and understand. Now, I'm going to try something I've never done before. Animating the data in real space, with a bit of technical assistance from the crew.
So, here we go. First, an axis for health, life expectancy, from 25 years to 75 years. And down here, an axis for wealth, income per person, $400,000, $4,000, and $40,000. So, down here is poor and sick, and up here is rich and healthy. Now, I'm going to show you the world 200 years ago, in 1810. Here come all the countries. Europe brown, Asia red, Middle East green, Africa south of Sahara blue, and the Americas yellow. And the size of the country bubbles show the size of the population. And in 1810, it was pretty crowded down there, wasn't it? All countries were sick and poor. Life expectancy were below 40 in all countries. And only UK and the Netherlands were slightly better off, but not much. And now, why start the world? The Industrial Revolution makes countries in Europe and elsewhere move away from the rest. But the colonized countries in Asia and Africa, they are stuck down there. And eventually, the Western countries get healthier and healthier. And now we slow down to show the impact of the First World War and the Spanish flu epidemic. What a catastrophe! And now I speed up through the 1920s and the 1930s. And in spite of the Great Depression, Western countries forge on towards greater wealth and health. Japan and some others try to follow, but most countries stay down here. Now, after the tragedies of the Second World War, we stop a bit to look at the world in 1948. 1948 was a great year. The war was over, Sweden topped the medal table at the Winter Olympics, and I was born. But the differences between the countries of the world was wider than ever. United States was in the front, Japan was catching up. Brazil was way behind, Iran was getting a little richer from oil, but still had short lives. And the Asian giants, China, India, Pakistan, Bangladesh and Indonesia, they were still poor and sick down here. But look what is about to happen. Here we go again. In my lifetime, former colonies gained independence, and then finally they started to get healthier and healthier and healthier. And in the 1970s, then countries in Asia and Latin America started to catch up with the Western countries. They became the emerging economies. Some in Africa follows. Some Africans were stuck in civil war and others hit by HIV. And now we can see the world today in the most up-to-date statistics. Most people today live in the middle, but there are huge differences at the same time between the best of countries and the worst of countries. And there are also huge inequalities within countries. These bubbles show country averages, but I can split them. Take China, I can split it into provinces. There goes Shanghai. It has the same wealth and health as Italy today. And there is the poor inland province Guizhou. It is like Pakistan. And if I split it further, the rural parts are like Ghana in Africa.
And yet, despite the enormous disparities today, we have seen 200 years of remarkable progress. That huge historical gap between the West and the rest is now closing. We have become an entirely new converging world. And I see a clear trend into the future. With aid, trade, green technology and peace, it's fully possible that everyone can make it to the healthy, wealthy corner.
Well, what you just seen in the last few minutes is a story of 200 countries shown over 200 years and beyond. It involved plotting of 120,000 numbers. Pretty neat, huh?
Any questions? I have one more video, but I guess you can all look up. I'll tell you. Yes. I guess it's very, I mean, you have OBGYN colleague right there. I think we can't tell the secrets out there. But, you know, I guess we have a lot of immigrants, we have a lot of countries where, you know, we have women with lots and lots of medical problems that just walk into your hospital and you do everything in your power. So it's not that we are doing really bad, it's that we cannot control those women who has those problems.
Overall numbers are so great, and there's such a disparity, and the biggest gap and the biggest problem is not even just prenatal care, but the key which has really come to the forefront in recent months, recent years, is preconceptual care. And to get those issues taken care of first, rather than, I mean, you've seen and I've seen the patients that show up at 39 weeks with a laundry list of problems, and they tend to, you know, skew overall. And you have a big concentration of those patients in rural areas. You have a large concentration in the urban areas. And because so many of those patients kind of fly under the radar, they lead overall to these high mortality rates, because there's a disparity in a lot of aspects of our society, but in terms of distribution, availability of health care, I mean, that's still a major problem here in the United States.
A lot of women are getting pregnant when they are older, and older we have more medical problems too. So, any other questions?
Hi. That was a great talk. Thank you for coming. I just had a question. So I used to know a little bit more about this, but I was wondering if you've seen on your travels interactions between different NGOs, because there are obviously a lot of different ones. And if you think that the fact that there are so many NGOs should be changed, if you have an idea of like a suggestion about how it would be best to tackle that, and their interplay in the government in the areas.
Very important question. There are so many NGOs out there, and you know, it is very important that NGOs also has to align their goals. Oftentimes I have seen that NGOs have the same goals and a lot of things are done duplicate. So I totally agree with you. A lot of things needs to be, I guess, modified. And if I was in Ethiopia and I was doing the same thing, another NGO was doing exactly same thing. So I kept on asking my NGO that, you know, guys, call them. I want to sit with them. I don't want to duplicate my work. Yes, things are needed, hopefully. Ideally, what should happen, a country usually adopts their twin hospital. Like my hospital adopted a tiny city called Debre Birhan in Ethiopia. So I partner with them, and then I take over whatever needs to be done at that place. It is my job. So something similar as a model could be adopted, but there is a big need for that. And you know, a lot of people do duplication. Resources are wasted that could be used somewhere. So, and a lot more other things. You know, you have surgical missions going out there. What is the right thing when you have a surgical mission? A lot of doctors go out there to practice their surgical skills. That's not the way it should run. So lots and lots of changes has to happen for people to get your trust back. Because a lot of countries, they don't trust NGOs because of the same reason. That, you know, oh, these doctors just come and they want to practice on me and things like that. So it's very important that, you know, we as a community who is really out there to help out women, we have to get together. And I was fortunate enough to sit in one of this meeting with the country of Ethiopia and their health ministry, and all the partners from US came in and sat on one table. And then we decided, okay, your hospital is going to focus on emergency medicine. You are focusing on OBGYN care. So that's when it was decided by the country. So that country has to take an initiative, in my mind. I hope that answers part of your question.
Do we have any questions from Arkansas? Please walk to the mic. It should be nearby. Thank you.
No, ma'am, thank you.
Go ahead.
We're okay out here in Arkansas. Thank you for your talk today.
No questions?
Can you hear me?
Yes, we can hear you.
Okay. We're okay out here. Thank you for your talk today.
Okay, thank you. For those of you who are interested in the video that she showed, there is a website called Gapminder, Gapminder, by Hans Rosling's organization. Unfortunately, he passed away a few months ago, but his son and his daughter are keeping his work going. So if you visit Gapminder, you will see some amazing videos about any health topic that you are interested in. We still have a few minutes for more questions. All the slides and the recording are posted on the NYIT website. On the NYIT website. And I'll share it with you if you need.
And also, don't even look at this slide. There is so much more out there. Just go to WHO's website. That is going to make you really, you know, be passionate about what you're doing. You know, I'm so glad that you all are here. And because you are here, because you are passionate about global health, and WHO has plenty full of material for you. I mean, definitely you're more than welcome to have this. This is just nuts and bolts of that whole directive. But yes, WHO is your go-to site.
Okay, if we have no questions, I just wanted to say a word of thanks to Dr. Isha Mehta. And she's available for mentoring for those of you who are interested in OB-GYN. And she will be kind of working with me, with several of you, and any projects you may want to do. And if you want to go on any of our mission trips, I'm recruiting her to come with us on some of the trips we go to. Again, thank you so much. We truly appreciate your help. Guys?